Let's begin by looking at this patient. She's actually a close family friend who came to me a couple of years ago with the chief complaint that she was unhappy about the appearance of her maxillary anterior teeth. And you can see several problems that she presents with. First of all, she has gingival recession on all 6 of these maxillary anterior teeth. And the reason that she has this recession is that she demonstrates thin gingival biotype. And this thin gingiva is prone to recession. Just from toothbrushing, from eating hard foods, this thin, delicate tissue breaks down. Now, if that same type of trauma from brushing or eating something hard occurs in another part of the mouth where the gingiva is thicker and stronger, it may abrade the surface a little bit and then it just heals back up. But in these very thin, delicate tissues, the tissue actually breaks down and the gum recedes and it exposes the root surface. And the other problem that we see in this patient's mouth is the presence of non-carious cervical lesions. I want to make sure that everybody here understands the term non-carious cervical lesion. So let's focus in on this area right here on tooth number 6, where the patient demonstrates this erosion of the root surface. The term non-carious refers to the fact that this is not caused by a caries process. If you take an Explorer and you press on a carious lesion, it's soft. But this area is not soft. As a matter of fact, it's hard. It's very hard. It's sclerotic dentin. And sclerotic dentin is one of the reasons that we've had problems with the restorative techniques in trying to restore these lesions. And we'll talk more about that in a few minutes. The term cervical refers to the fact that it occurs at the cervix or the neck of the tooth where the crown and the root meet. So this is how the patient presented before surgery. And look at the difference now following surgical treatment. We have thicker tissue, we've covered the roots of the teeth, and those non-carious cervical lesions are now covered by soft tissue. And I can tell you, and this will be of interest to the hygienists in the room, that when you probe these areas, we get 1 millimeter probing depths. The attachment is a very firm attachment to these roots. Let's take a look at a patient with a similar situation in the mandibular anterior. And if we zero in on teeth numbers 23 through 27, again what we see is gingival recession. This is caused by a thin gingival biotype. And we have incipient non-carious cervical lesions beginning on teeth numbers 23 and 24. So we take a look at the results following surgery, and we can see that we've been able to cover the root surfaces with soft tissue. We have thicker gingiva and thicker mucosa that should resist further recession, and the non-carious cervical lesions have been covered. The surgical technique that we employed in this case and the previous case was the papilla retention pouch procedure, and the material that we used was acellular dermal matrix. And one of the brands of acellular dermal matrix is Perioderm, which is distributed by Dentsply. Dr. Walker is going to give you a lot of information about the surgical technique and about the material, acellular dermal matrix.